Hi, my name is Angela Mason, and I am 36 years old. I'm married with two kids, Anthony and Hazel. Anthony is 2.5 years old, and Hazel is 11 months old this month. I live in Kansas City, Missouri, and I am living with a congenital heart defect. I'm living with congenital heart disease. I was born with a bicuspid aortic valve. I've known about it my entire life. We found out, well, when I was a baby, when I was an infant, my mom took me to a pediatrician and they heard a murmur. And they said that the murmur wasn't a big deal and that eventually I'd grow out of it. And so mom never really thought anything much of it. And then when I was 8 years old, going on 9, I was getting ready to go to Girl Scout camp, and my mom had procrastinated and not made an appointment with the pediatrician. And so she took me just to a family doctor that was right up the street by our house to do the physical. Her name was Dr. Barney. And when she listened to my heart, she looked at my mom and said, "You need to take her to a cardiologist immediately." So began my my heart issues. So mom took me to a cardiologist, a fantastic pediatric cardiologist named Dr. Knat, and they listened to me. And back in the mid 80s, there was no, there wasn't as much technology, so they didn't call it a bicuspid aortic valve at that point. They said that I had a leaky valve with narrowing. They threw around talk of surgery, but decided just to kind of see how things worked out. And so basically, up until my mid to late 20s, I never really talked much about my heart. My parents did a fantastic job of making sure that I lived a really, really, really normal life. My heart never really even was discussed other than my yearly checkup with the cardiologist. When I was a child, elementary school, middle school, high school, I swam competitively. I went to state. I competed on a national level. And my heart never gave me any problems. And actually, they thought that, which I doubt was the case, but some of the regurgitation or the leaking, they thought went down a little bit just because my heart was so strong from the swimming. When I was mid to late 20s, as I mentioned, my doctor, Dr. Gimple, who's still my cardiologist, decided to start talking to me about my heart and pregnancy. He said to me at that point, "Have you thought about having kids?" And I said, "Well, not really." At that point in my life, my ex-husband and I owned a couple of restaurants down at the Lake of the Ozarks, and kids just weren't really on our, weren't really important at that point. But, he said to me, "If you are even considering it, you need to do it sooner than later. With your age, you're getting older, with your heart condition, the longer you wait, the more problems you could possibly have." So I agreed to go ahead and do some testing. I, had to do some stress tests to make sure my heart was strong enough to handle pregnancy. I also did an MRA, which is like an MRI, but they focus on your heart. And they did like this whole really cool 360 where I could see my heart. It was really neat. Anyway, and they determined that if I chose to get pregnant at that point, that I should be fine. My ex-husband and I obviously did not choose to have children. We ended up separating, and in 2012, I met my husband, my current husband, and we got pregnant with my son, Anthony. And really, I had a really normal pregnancy. I had to have extra I had extra people watching me and watching my heart. I went and saw a cardiologist. I saw a perinatologist. The perinatologist is somebody that basically is focused on the baby, not me. My cardiologist obviously was focused on my heart, and then I saw my OB who was focused on my body and the baby, but everybody had a different role to play. I carried Anthony to term. They wanted me to deliver, a natural birth. And in natural birth, I mean a vaginal delivery, no drugs. With heart patients, they want you to do a vaginal delivery, and then they give you pain meds, basically, to keep your heart calm. They don't want you to do a C-section just because of the anesthesia. It's pretty rough. Unfortunately, by the grace of whatever, my body and did not progress, and I ended up having to have a C-section. But like I said, with Anthony, everything was fine. I delivered him, and breastfed, and everything was great. In 2000, I guess it would have been 2014. In the summer, I found out I was pregnant with my daughter, and I had an echo, the year right after my son was born, and my echo was scheduled for September of 2014. When I had my son, I had a bicuspid valve, well, I still do, with moderate regurgitation and moderate aortic stenosis. That was when Anthony was delivered. So I went in for my echo 2 months after I found out I was pregnant with Hazel, and I found out from my doctor that my stenosis had moved into severe. When your stenosis becomes severe, you have to start talking about replacement surgery, and there's not a lot of women who have delivered babies with severe stenosis, and so an insane panic ensued. I mean, it was just like, doctor didn't actually really know what to do. I was sobbing. My husband was a mess. I mean, it was just mass chaos. We were in Kansas City, and not a lot of doctors here have ever seen this in the Kansas City area. There's no hospital to go to. It's not like we can just pop on over to the one that handles bicuspid aortic valve women with severe stenosis delivering a baby. There's not many in the world, or in the United States. So through a lot, I ended up carrying Hazel to term, and I'll do another video about her delivery. It was pretty crazy, but we made it. It was rough, but Hazel and I made it, and she was delivered at 36 weeks, February 26, 2015. And after that, everything seemed as normal as it could be with two kids. And it was a couple months ago that I noticed that my symptoms were getting worse. I started having a lot of exhaustion coupled with having a newborn. I had dizzy spells, are probably the biggest thing that I've noticed. I have dizzy spells really, really bad. And then on top of that, in the last few weeks, I've started developing difficulty breathing. I've been tested. I'm not going into congestive heart failure. It's just that my symptoms are, where they are. So we've scheduled aortic valve replacement for January 12th, 2016, which is next Tuesday. Today is January 6th of 2016. I've decided to get a mechanical valve, which there's a lot of controversy on mechanical or tissue valve. I've decided to go with the mechanical valve due to my age. The drawback is obviously that I'll have to be on warfarin for the rest of my life, which is awful and horrible, and I don't want to do it, but I also don't want to have open heart surgery again. And the idea is that the mechanical valve should last me until forever. So that's kind of where I'm at. So what the point of this blog really is to just kind of give you some guidance on my experience. I want you to know if you're going through this, or have a child who's going through this, or just, a family member, or just needs some support. That's what I'm here to do. I want to tell you what's happening with me. I want to start a dialogue about this, because I've met a lot of people in my situation, and there's just not a lot of resources out there, especially for people that are young, that aren't in their 80s or 90s. I think we need to have people to reach out to. We need to have these resources and make these connections. So anyway, please feel free to leave a comment. You can follow me on Twitter. Please contact me, and obviously I'll get back with you. We can talk, and I can put you in touch with support groups, or even just give you support from my end. So anyway, thank you for watching, and look forward to more videos coming soon.